All right, welcome everyone. We are just about to get started. My name is Dr. Ram of Regenerative Health Medical Center. Today we're going to be doing a webinar on the nervous system, more specifically how the nervous system has some underlying ways of attributing itself to longevity, resilience, recovery, and one of the methods to looking into that includes heart rate variability, which we'll cover in some depth today. And before I get started, I'm just curious, anyone in the chat or can speak up whether they hear my volume all right? Is that coming through okay? Let's see, the chat active. Anyone able to drop anything in the chat? I should have opened it up to everyone. Excellent. All right. Thank you so much, Sue. I appreciate that. Feel free to drop any questions if you'd like in the chat, or at the end we can go over some Q&A as well, or just chime in and let me know and we can maybe catch it on whichever slide we're on as well. So let me just start with sharing the screen. And again, for those of you who've just come in, we are doing a webinar on the nervous system. My name is Dr. Aram. I will be presenting for Regenerative Health Medical Center. Let's get that presentation going. Excellent. All right. My screen there. All right. Okay. So the topic of today is why you feel wired but exhausted. Pretty common clinical presentation I'm seeing as of late. People are coming in burnt out, but also unable to wind down and let themselves go into a restorative phase. The hidden role of the nervous system in stress recovery and resilience. So what is that hidden role? What are we talking about here? All right. So can move on to the next slide. So, do you ever feel like you're unable to relax? I'm curious. Anyone feeling mentally drained but physically tense? These kind of interplays where the mind is foggy, but the body is amped up and ready to go. Maybe we're tired during the day, but then we're alert at night, stuck in a stress response, even when everything seems pretty much okay. Always in a recovery state, but never fully recovering. These are some of the complaints I see in the clinic coming in with people struggling from anywhere from, gut issues to anxiety, to even hormonal changes as we age. Some of these can be attributed to those more physiologic factors from a gut standpoint, from a hormonal standpoint. But the big missing piece that a lot of times certain protocols don't take into account is the nervous system. So we can come up with a wonderful treatment plan and a wonderful set of supplements and lifestyle changes that are really going to help supercharge one's health and get them back to feeling stable and able to function without as much support. But we don't see the progress that we'd like to. And a common factor that is missing is a really good approach for nervous system. A lot of people don't feel completely on, but then they also don't fully turn off, if that makes sense. That's kind of the tired during the day but alert at night picture. And this is where we start talking about the dynamic nature of the nervous system. So this is more common than people realize. Many people assume it's just aging, perhaps stress, burnout. But like I mentioned, what's often overlooked is that nervous system and its flexibility. And what I mean by flexibility isn't necessarily what we would think of in a yoga class or in sport, but really the ability to move from one position to the other. So from activation to recovery or mobilization to restoration. Those are the kind of the factors we're talking about with nervous system flexibility and shifting from one to the other with relative ease. The core concept behind this is, again, from the nervous system, the autonomic nervous system that has two components. Essentially, right here, we're saying that body has two jobs. It is to respond to stress while also recovering from stress. And we can really distill it down to that sympathetic mode, which is alert, survival, performance. This is our body inputting stress, realizing there is something that has captured our attention, and really putting us in the mobilization, that sense that what we're going to do next really matters. It kind of adds a little drama to our life. You'll notice the blood flow changing, heart rate going up, muscles tensing, cortisol might even rise. This is really a design for the body to get ready to either, let's say we were back in the paleo times, run away from a threat, and modern era perhaps respond to some type of stressor, be it traffic has a rise, we're late to work, we got to send out the text, we got to do the calls and let people know that we're delayed. It's sort of that awareness that something needs our attention and we're being driven towards meeting those needs. Whereas the parasympathetic is really when we start letting go and letting the body do its own thing, be it healing, repairing, restoration, our rest and digest. You might have heard this is associated with the parasympathetic nervous system. I like to think of it as parasympathetic takes longer to say, as opposed to sympathetic. So parasympathetic takes longer. We're in that slower rest, digest. Our heart rate has come down, our muscles are relaxed, cortisol's dropping, and we're really putting ourselves in a position to rebuild. This is generally speaking what we feel when we've come home from a long day and we're on the couch and we're just ready to relax and chill. Where some who might be in that same position, long day of work, lots of stressors that came up, they're expecting to come home to relax, to unwind, but something doesn't feel right. There's an antsiness, there's an edginess when they hit that couch. And it takes a while for their body to catch up to the signals that say, there's no more stress. This is our time to really wind down. So that's what we're talking about with a healthy nervous system moving fluidly between the two. We're not trying to demonize stress, nor are we trying to always be in that ashram-like yogic mentality that we're not affected by things. Modern life really needs our ability to both respond to when the green light says go and to slow down and stop when it says yellow light or red light. That's really what we're looking for in a well-adapted, well-responsive nervous system. So common presentation, like I mentioned, we do have the challenge of modern life. People are finding themselves stuck in activation. The body is able to adapt. So there's good signs that if we're able to push ourselves into survival mode, we can also bring ourselves back out. But really what's driving us to be in that survival mode is fairly often we have constant stimulation. Some of us have better boundaries with our cellular activity. Some of us have the inability to have those boundaries, be it having kids or responsibilities from work, needing to be on an ability to be notified or have the news brought to you. This kind of noise, we call it, is coming into our nervous system, even in a way that isn't necessarily stressful. If the nature of the content is mild, like, hey, are you open for dinner tomorrow night? Or, hey, did you get that fax sent in? Mild, not really big stressors can mount over time just due to the consistency with which life is kind of pushing at us to be stimulated. And in this modern world where we're all connected with phones and able to get, from the West Coast to the East Coast with just a few words, a few messages, we're very connected in a lot of positive ways. But with that, there's also the ability to be overburdened by that connection. False energy is another thing we can discuss. Over-caffeination. Well, there are many benefits to having a clean cup of coffee, having the proper time of day, having it in terms of relative to our meals, probably after our meals is going to be better for our overall cortisol production, not ramping our body into a stress state. There's ways to use caffeine effectively, but what happens with over-caffeination when that second cup of coffee starts creeping past noon, and we just keep filling our cup with that caffeine, we start operating off willpower, off adrenaline, off these systems that were really designed to be pressed here or there just to get us through a little bit more of a hectic schedule. And when that becomes our normal and our nervous system adapts around it, we can be very reliant and also essentially walking ourselves towards burnout by having that type of false energy. Let's see, I got something in the chat. Um, I froze. Am I still frozen? Is connection going through okay, guys? Anyone hear me speaking clearly? Is there still an issue with freeze? All right. Well, all right. It looks like we're back. Sorry about the interruption. I'm not sure where we got cut off. but participants are still here. That's wonderful. It looks like my internet is working fine now, so let me just go back to the share. All right. So where were we? Right here. Okay, wonderful. And sorry about that, guys. I hope it's working effectively now. So really, like I was saying, we can have this false energy. We could have poor recovery, shallow rest, inability to downshift. There are a few factors to this, like, are we having caffeine close to bedtime? Are we eating close to bedtime? Sleep hygiene in terms of blue light activity, multiple different things that can lead to disrupted recovery. But one big aspect of it is our ability to flex from active sympathetic nervous system to rest and digest parasympathetic. And the body does keep the score in this way. There's a measurable way to see exactly where we stand in terms of our nervous system adaptability, flexibility. And what is that measurable outcome exactly? Well, let me get back to presentation mode so we can switch from slide to slide. All right. It is called HRV. This is the measurable signal we've been talking about. Heart rate variability is what HRV stands for, and it's the body's built-in measure of stress, recovery, and resilience. Some of you may have heard of HRV. It's been getting a little bit more popularity over the past few years, but it has been around for a while in terms of exercise science, in terms of cardiovascular health. But really, more and more from a nervous system standpoint, we're seeing that heart rate variability is a wonderful way to tap into how are we actually responding to stress and how able are we to shift from being in that stress state to that resilient recovery-based state. So why does HRV matter? HRV is not just a wellness metric. It reveals real physiologic resilience and how the body adapts under stress. I'll say that again. It reflects real physiologic resilience and how well the body is adapting under stress. Like I mentioned, cardiovascular risk has been associated with lower HRV. That's where it's gotten a lot of its earlier popularity. Large-scale population studies show this. Stress and burnout are also associated with a lower HRV. Chronic stress from lifestyle factors, be it what we're putting into our body in terms of foods, in terms of toxins, and also from what we're taking in visually. Are we watching a lot of distressing news or getting really tapped into, parts of society that are putting us in a bad headspace and not doing enough work to also think about the gratitude and think about the good things in our life. And it's very easy to get stuck in the cycle of fueling our HRV in a negative way. But it can also bounce back in ways of resilience and recovery. We can see our HRV go up, and generally speaking, we'll notice emotional regulation increases, recovery capacity increases. There's just an overall greater sense of adaptability between stressor to stressor, and we're not feeling that it takes us as much time to regulate in new environments in terms of kind of finding that homeostasis, that calm, um, equanimous state of being. And research is continuing to explore this. We're going deeper and deeper. The more that we're looking into different devices that can help stimulate HRV, different medications, supplements, lifestyle factors, all these different ways we're trying to find in terms of influencing HRV, even fitness. Zone 2 cardio has been getting a lot of push for measurably increasing our HRV over time. So it's not just about the heart, it's a window into how well the body is adapting to life. And now we can go into the physiology somewhat. What is HRV actually measuring? HRV is measuring beyond the heart rate. It's the variation in time between the beats, not just the number of beats. And I'm curious, some of you may have heard that HRV is actually better when there's more variability, and that is correct. I had the misconception that a very consistent metronome-like heartbeat is going to be better for overall survival, better for overall resilience, and just well-being. But that in fact isn't true. If our heartbeat is going, let's say, 60 beats per minute, having a little bit of variation between the two beats, and instead of having the perfect space evenly put in between each beat, that's actually a better sign. When we have that variation, when our heart rate is not a consistent fixed number like it would be on a click track or a drum machine, it's a sign that our body is receiving input from our external environment and responding well to it. It's both showing our heart strength and our heart health, but also its ability to communicate with the brain and the nervous system overall. So that's where we see the nervous system adaptability come into play. And with that, that goes into stress and recovery, how quickly you're able to shift between the stress, fight or flight, and the recovery, rest and digest. But then also, are we seeing certain trends that lead us to increase our HRV over time? Are we seeing other trends that are leading to lowering it as well? And we can use that information as feedback for what we want to put into our life and what we want to take out a little bit more from our life. And this is kind of diving into what I was mentioning between the variability that low HRV is going to be considered an even, rigid, compressed type of heartbeat. Each beat is going to arrive at nearly the same interval. You can see the space in between the beats here. There is some variation, 859 milliseconds, 793 milliseconds. And those who have a very, very small window of variability tend to have less adaptability in stressor-like environments, and also the ability to move away from the stressed environment and into a parasympathetic state in the body. Those with high HRV, we're seeing those beats intervals shift naturally. It's a sign that the nervous system is really responding to our external environment, and it's a variable, fluid, responsive-like system. The variability reflects how adaptable the nervous system is for the most part. So health is not the absence of stress. I'm not here to say poo-poo stress. We don't need stress. Stress is actually a very important part of our makeup. We would not be breathing, living, and thriving without it. But really, health is the ability to recover from stress, to respond to stress in a way that is actually favorable and doesn't keep us stuck in a certain cycle. So when recovery stops happening efficiently, you might notice some symptoms. The impact can be persistent fatigue, burnout, anxiety, brain fog, reduced resilience, that mention of feeling tired but wired. Really, it's not just the heartbeat being a pump. Sometimes the heart can be described simply as this is just a glorified four-chambered pump. But it's more of a living, breathing organ than we give it credit for. There are nervous system there's a hardwiring into our heart that allows us to change the pressure that the heart is feeling from our breath. As we take in inhales and exhales, that puts pressure on our heart in a way that allows us to respond to increased demand, whether we're running, whether we're just sitting but feeling that fast heart rate. All of that is information that the heart is taking into its nervous system, into the actual nerves, and sending it back to the brain. And there's this back and forth communication between the heart and the brain. And considering how our lifestyle and how our current state of mind is affecting the heart is just as important as considering how much the heart is affecting the brain. And we can talk about how we're going to work to manipulate the breath or manipulate our state of mind so that we can increase our likelihood for a higher HRV. But many people who are trying to heal while their body still feels it's under threat are struggling to be in that stuck place, that feeling you get when you think you're doing everything right, you're eating the right meals, you're going to bed at the right time, but you're just not responding the way you used to respond. Some of that can be from the nervous system really being in a loop of that sympathetic place taking over and not enough of that parasympathetic. And again, some insights into what low HRV can reflect. We might notice it starting to trend down when chronic stress load increases, when sleep quality goes down, systemic inflammation, those who have been burdened by some type of illness, maybe some kind of gastroenteritis. If anyone's wearing these measurable devices that actually track our HRV as we sleep, you will take quite a bit of a hit in HRV when some of these metrics start going down in terms of perhaps even too much exercise, for example, too much of a good thing. That overtraining, seeing our HRV trend down, and yet we're not scaling back in the gym or shifting our approach. We're just going to keep seeing that trend down because we're not actually allowing our body to go into that rest phase. And we're just pushing and pushing and pushing on the gas until our body essentially shuts down and refuses to really operate at the same level we'd like it to. And like I mentioned with illness, immune changes, that's part of it as well. Alcohol and stimulant use can affect our HRV, and prolonged under recovery. That's kind of that overtraining picture, that sense that we're really refusing to listen to our system, and pushing, thinking that more and more is better, where taking a step back might actually lead us in the long run to improve our overall health metrics. And I just want to point out here, HRV is not diagnostic. Seeing a low HRV or dip in HRV cannot necessarily point to, you have a sleep issue, you have an inflammation issue. These are all things that are trending with HRV, and we can see they impact HRV, but really a full workup is going to do a better job of seeing what is the most offensive agent, what is causing HRV to decrease. And that can be done, with a healthcare practitioner such as myself, or even any psychologist that you're working with. There are ways to, really dive into what lifestyle habits are going on and what really is impacting your HRV. So why are modern people struggling? Well, I think I alluded to this earlier, but we're not designed for constant activation, constant screen time, productivity culture. There's no real downshift in the culture. The stress tends to become in charge of our life. And if you want to go through this exercise with me now, just a quick visualization for those who are able to, close your eyes and picture yourself in a temperate beach, a little warm, but not too warm. You're staring at some turquoise blue water. The sound of the waves are coming in gently and receding back to the ocean gently. Maybe we're lounging on a nice beach chair. We've got a nice amount of shade covering us, maybe a beach umbrella or, a palm tree. We got a nice coconut full of a virgin pina colada or some kind of tropical drink. And I mean, I'm sure you can even feel it right now, the sense of calm and relaxation and ease. And that's a mental state that some of us are able to tap into more readily, some a little bit less readily. But if I imagine, let's change the visualization, and now we're in a small room, fluorescent lighting. We're in our business, maybe business casual clothes, and we're preparing ourselves for a speech, maybe a presentation, some kind of public speaking. You might start feeling your heart rate going up a little bit, just even imagining it. And this is really that subtle change, that distinction I'm talking about that happens under the surface. If we stop and we breathe and we check in, we might notice ourselves tightening up a little bit at that thought, getting a little nervous. But that nervousness can be used for our benefit. That can be what sharpens our brain, turns our signals on. And really, that's what we're talking about here is how do we use stress in a way that puts us in a position to succeed, but then doesn't keep us there trapped and stuck in this one phase. We're able to uncouple from that ability to be motivated by stress and lean into that nice serene like picture we were discussing. And if we can just change our mental state, our physiologic state with just our thought, imagine what we can do when we start employing some of these techniques that are designed specifically for HRV shifting. So that was just a quick thought exercise, but back to the meat of it, really many people are living in a constant recovery deficit. Stress is accumulating. There's no true downshift. And downshift, by that I mean that sense that we can let go of the responsibilities, let ourselves go into that rest place. And the deficit grows because really you can't outperform a nervous system that never gets to recover. Short-term sprints, some fields, I know we just got out of tax season, but accountants, for example, or other individuals that might have a heavy season. Yeah, of course, we're gonna have to have times where we're really, more motivated to just put pedal to the metal and get after it. But there's also that ability to know how to train the skill of letting go, and becoming more in our accepting and surrendering place of being and less in our control and overexertion state of being. So the misunderstanding I find, and this hurts my heart when I see it in the clinic, is people who beat themselves up, right? I just need more motivation, or I just need more caffeine. I need to push harder. I need better discipline. A lot of this self-blame and this self-judgment can be pretty damaging because now not only are we dealing with a depleted nervous system, we're dealing with some negative self-talk. And while it can be motivating in the short term, down the line, it can just lead to a lot of pressure and a sense of entrapment in the whole process of trying to achieve our goals. So for some, a different approach is actually using a strategy that's going to support the nervous system, and really thinking of the nervous system as a muscle like you would any other muscle that can be trained. that can be systematically improved and checked upon. And how are we going to check upon that? Well, this is the turning point. This is kind of the meat of the presentation in terms of the different things we can do. The nervous system can change, though. I want you guys to understand that the body is adaptable, recovery can be trained. We may have heard in the past that the autonomic nervous system is out of our control, and thank God for the most part it is because we have a lot of factories going on in the back of our brain. We have, making sure we're breathing, our heart's beating, a lot of things that, our body's basically doing on autopilot, so our minds can go elsewhere, go into problem solving, conscious choice making. So a lot of these autonomic systems are designed to keep our body functioning at a baseline level, right? The thing is, if we subscribe to that idea that we can't train the nervous system, that our autonomic nervous system is completely in control, why do we see certain lifestyle factors or certain behavioral choices shifting our nervous system? Right? It's not as simple as we turn the switch on and now we're awake, and then we turn the switch off and now we're asleep. Certain impressions we put on ourselves, be it working late at night or waking up in a really rushed stance, not giving ourselves times to ramp up in the morning, not getting any morning sunlight. These things shift our ability for our nervous system to change. So researchers started to look into how we can actually change our autonomic nervous system. And ancient techniques like meditation, for example, or some of these yogic techniques, some of these Taoist techniques are things that have been employed for quite some time that when done under the oversight of research did show measurable changes in a variety of health outcomes, HRV being a big one. So recovery can be trained, and our nervous systems, while mainly operating on an autopilot-like function, can still be influenced by certain techniques that we're going to discuss here. So how do you teach the body to recover again? Big four factors here are recovery practices, being consistent and intentional in the inputs we're putting in our body. Like I said, we want a consistent effort, not an intense effort. If I asked you to meditate for 45 minutes without any prior training, you guys would all jump out of the room. But if I asked you to meditate 5 minutes a day, every day for 45 days, my goodness, you might start craving more than a 5 minute meditation over time. You're giving the body the ability to really take the practice that we're imploring in and make it tangible and not just a thought exercise, but something the body starts to feel. Much like when you start working out in the gym, the joints hurt, things feel achy, your mind gets in the way. It says, I don't know how to do this. I'm not as strong as everyone. But pretty soon, if we're consistent with it, we start craving the gym. We start craving the sensations and the endorphins we get from exercising and going to the gym. And much like these practices we're going to discuss here, we create a sense of physiologic safety. We allow the nervous system to start regulating, and we start being drawn to these practices that tell our body it's safe to release, it's safe to come down. And in this sense, what we're going to talk about here, biofeedback, recovery is not passive. It's a trainable physiologic skill. We like to marry both, our ability to fall asleep at night and let our body do its recovery processes, let our brain go through the different sleep cycles and flush out the bad thoughts, bring in the good thoughts, synthesize, create good neural connections. That all is passive. Sure, we're asleep, we're not really engaging. But the trainable part here, what we're going to discuss with biofeedback, is much like going to the gym to train your muscles, an active way of training your nervous system. And what we see with that is real-time nervous system feedback is a form of biofeedback. And that is where we're using different devices, some things like, a band around the belly to measure our rate of breath, our depth of breath, clips on the ear, on the finger that are measuring our heart rate and how that's changing, the space between. It can directly measure our HRV and give us HRV scores. And really what we're doing is we're pairing that real-time feedback with trainings and breathing techniques that we've seen, work over a variety of different research, variety of different, like I mentioned, protocols from meditation, some of these things that were, being employed prior to actually having objective data, but people would report feeling calmer, feeling more grounded, emotionally regulated. We're doing all of these strategies in conjunction with some type of device that's measuring and giving us objective data as to how our body is responding to those specific patterns. Guided breathing patterns can range from increasing our exhale length compared to our inhale length, changing the amount of time we hold our breath in between exhale and inhales, even alternate nostril breathing. These are just some of the ways that breathing can actually be the intervention that leads us to see how our nervous system is responding. And there's other facets of biofeedback, body temperature changes. There's even neurofeedback, which goes more into the scanning of the brain itself. But the beauty of biofeedback is it's not passive, it's an active training method. It's giving us measurable feedback and able to really tailor our treatment protocols so that we're pushing our body in not an excessive way and not in an understimulated way, but in a consistent, repeatable, trainable way that builds a nervous system resilience over time. So what is it actually going to look like? Like I mentioned, we might experience a slowness of breath. Most of us breathe between 12 breaths to 20 breaths per minute. And with biofeedback, we're scaling closer to that 12 breaths, even getting all the way down to 6 breaths per minute. And what I like about biofeedback as opposed to doing some breath work, which by all means, go to your breath work classes, your yoga classes, those are all still very helpful. But what biofeedback does for someone who really is struggling to shift from that sympathetic to parasympathetic and back and forth, it allows us to do the most optimized form of breath work, meaning we are getting that measurable feedback from our systems, from the different equipment we're tapped into, and we're able to change the breathing pattern, augment it to be very specifically beneficial. Sometimes if we're trying to slow our breath too much, we might stress our body out. It's kind of like, again, going to the gym. I'm going to keep going to that example, but lifting a bicep curl for 1 rep at the most weight you can do before you've even really learned how to comfortably do 8 with good form. Some of that is pushing the body too quickly. So some of these breathwork classes, these approaches can be helpful, but they can also overburden the body. And for those who really need a fine-tuned treatment plan, having the biofeedback approach gives us objective, measurable data that is telling us, hey, actually, we're slowing the breath too much. Let's elongate it some here. Let's give ourselves a little bit more breaths per minute, and then over time we can scale it down to have a fewer breaths per minute. But in general, we're trying to find a comfortable rhythm. We're using the clinical insight coming from the patient themselves, as well as from the hardware and software that we're using to measure the biometrics on the person to really come up with the best possible approach for them. And then also paying attention afterwards with a little bit of conversation as to, did you feel that shift when we hit minute 16 of the breath work? Because that's really when the data said that everything calmed down and you got into a parasympathetic state. Did you notice that? And even talking it out, bringing awareness and attention to maybe how the body shifted, how our thought process, the speed of our internal dialogue has shifted. All those can embed themselves in a way where we leave the practice room and then are able to go implore or employ our new breathing techniques or our new sense of calm in moments of heightened stress or moments of traffic where we would normally get dysregulated. We're finding ourselves being a little bit less reactive, a little bit more calm, a little bit more able to just take things in stride. And common approaches include resonant frequency breathing. That's kind of that specific breathing pattern I was discussing that really matches with a good HRV. Different heart math style coherence trainings. These can include using the metrics that are being measured by the biofeedback software to augment things on the screen. Let's say we're playing a game where the better our HRV is going up, the more the screen lights up, the more we progress through the game. Those are different ways that we can engage some individuals who need more visual stimulation and maybe don't do as well with closing their eyes and working with the breathing pattern. So there's different ways that we can get into a nice HRV coherence mentality while employing these different approaches. But in general, we've seen large-scale HRV biofeedback research showing more coherent heart rhythms that are associated with greater physiologic stability and more positive emotional states. Recovery is not just something that the body needs, it's something the nervous system can learn. And again, when we're in this modern life that we're putting too much stimulus in, it's easy for us to train ourselves unintentionally, but in a way that tells us to not really value that calm nervous system. And this is where these approaches really, really shine because they allow us to take the reins back and bring ourselves back to a place where flexibility comes into play. Going from activated nervous system to calm nervous system can really be engaged. Let me see if I can see anything from the chat. No, nothing in the chat. Okay, wonderful. So who can benefit from nervous system training? Well, like I said, many people function well, but for a time, and they're not fully recovering. So you might find that you're a high performer, you're always on, type A personality, you're productive on the outside, but something feels a little off. You don't feel like you're waking up with the same vigor. Thoughts may be interrupted with feelings of overwhelm. These are signs that the nervous system is starting to power down, even if the external looks like we're performing at the same level that we were before. Again, the exhausted but wired picture is always an indication when I see, potential cortisol dysregulation, potential adrenal gland dysfunction, but really nervous system is kind of what I want to tie things back to when I see that in the clinic. Where is the signal coming from the body that we are not able to rest at night? What is that impression coming in? And can we start to decouple that narrative that we have to always be on so that we can start actually feeling rested when we're meant to rest and feeling, energized when we're meant to be energized. The burnout recoverer, this is when the individuals are past the breaking point of rebuilding, and they really just need a break, but they don't have time for a break. So, what do? Well, we give ourselves the ability to walk through life with a little bit less of a rock in our shoe, for example. We may feel that we don't have time to untie the shoe, metaphorically speaking, take the rock out, and continue going forward. But the reality is, those who feel that they don't have time to do anything like a biofeedback training or a nervous system based training, they probably need that recovery more than any other person. So that 10 minutes a day of some type of mind body exercise to help train the nervous system to be more responsive and adaptable might end up saving you an hour over the long run because we're making less errors. We're a little bit more turned on, tuned in. We're tapped into what we're trying to accomplish and not constantly scattering and looking for the next kind of shoe to drop. We can go from that negative headspace that a lot of us get caught into when we're in a stress cycle into more of an opportunistic headspace just by having a little bit more of a adaptive nervous system because our mind and our internal talk is very correlated to how our nervous system is doing. Again, active individuals, people who are, going after it at the gym, athletes do a wonderful job with specific biofeedback training. Those who are working for both recovery, maybe you're trying to tack on muscle, your growth hormone has gone down as you've aged some. It does not necessarily have to end with age. It can be brought back. We don't need strong peptides or these signals from external medications that sometimes are necessary, but sometimes it can just be what are we telling ourselves naturally through our lifestyle factors. And if we're a go-getter at the gym, we're a go-getter at work, or go-getter on the weekends, and we're a social butterfly, but we haven't given ourselves the skills to train the nervous system to recover from that constant activity, that's where I get a little concerned that we're setting ourselves up for failure. And some of us have some mental overwhelm. There are lifestyle things that come into our play that are just out of our control. Loss, grief, big changes, moves, job changes. These are things that sometimes are out of our control, but that's when really using the skills that are within our control take front seat. And that's when I would love for my patients to feel that they have something they can turn to on their own in the moment at the line in the grocery store or in the car before they get into the office. Not just a pill that they're looking for, not just an audiobook or a way of escaping, but really something that's trainable and a skill that they build, like a breathing practice that comes from a biofeedback. And the resilience seeker, those who are just constantly looking to optimize their ability to really have all these tools and skills that we want to live a full, happy, resilient, long life. HRV and biofeedback training may help improve awareness, adaptability, recovery capacity, and nervous system resilience. So, if any of those are goals of yours, that's where I think nervous system training and biofeedback in specific can really be a benefit. Um, and how do we support the recovery more effectively? We've discussed this some: foundation, sleep, recovery, nutrition, hydration, movement, and rest, all the basic things that we're supposed to be doing with as much regularity, without being overly perfectionistic, but moving towards that 80-20% lifestyle? Am I getting good sleep most of the time? Am I getting good nutrition most of the time? Tipping the scales towards that direction? Great. We've got those foundations in place. Now what? Well, now maybe we can also get some regulation training, some HRV, some biofeedback, whatever breath work or nervous system training that really works for your system and is also doable at home, away from the practice, so that you feel encouraged and motivated to actually do your nervous system training. Both of those are going to be wonderful for getting you into that recovery mode. But those are all very active approaches. And that's, again, I've been pushing that. It's good to have active ways to engage into recovery. But with that too, there's also the letting go that comes with being in a more resilient, recovery-based nervous system state of being. That letting go, that recovery comes from supportive modalities like PMF therapy or gentle hands-on support, be it massage or craniosacral if you're a fan of craniosacral. There are some restorative therapies that when you're already working on your nervous system, my goodness, you're going to respond so much more because you're already tuning the nervous system in to be a little bit more willing to let go, to get into a state of recovery and restoration, to let the natural healing body take over and that vital force that we talk about in naturopathic medicine to really shine. One way to amplify that is to get, some type of regular body work done, be it through a PMF or through a craniosacral. And these approaches support recovery through different mechanisms, but the shared goal is improving the body's ability to shift into recovery states more effectively. And just a quick word on some of these approaches. Craniosacral, if you haven't heard of it, it's a very gentle practice. It's not quite like massage. There is some massage-like holds, but really the idea is allowing the body through proprioceptive awareness, being aware of the body in space in real time, with the help of a practitioner, someone who's facilitating certain holds on the body, be it elevating the head and giving a little bit of tension from the neck muscles, putting some soft, gentle maneuvers on the belly for those who might have some GI distress. But really, craniosacral is, if you can think about it, as a very gentle, hands-on approach that allows the body to just let go, be taken care of, bring subtle awareness to places that have tension patterns. The body can hold on to stress in a very repeatable way. And especially after a few sessions of this, we start noticing, oh man, I always have tight neck muscles, but really now that I'm calming down and getting some craniosacral, I'm realizing that the low back has been just the source of my tension. And my shoulders hike up, but now that we're calming down, man, my low back is starting to talk to me. And these places that have been essentially turned off or not really responding or firing will start to light up again. And with that awareness comes the ability for the body to actually address those areas that are not necessarily healing or getting the same amount of attention as other parts of the body that might be getting a lot of attention from overuse and overburdening. So CST is really great for those who need a little bit of a gentle relaxation approach. Massage obviously feels great, good on the muscles, good for flushing the tissue of any toxin burden, lactic acid. But craniosacral has this ability to kind of exist in that in between space. It has some of the energy medicine qualities and some of the physical medicine qualities. Another approach that really has that is PEMF. What I love about PEMF, it can be done both passively and actively. And what I mean by that is there are PEMF mats. PEMF stands for pulse electromagnetic frequency. These are low-level frequencies that are designed to be at the resonance of your body. And what's amazing about it is, unlike other EMFs that might be more troubling and dysregulating for our thought processes, for our nervous system, these are design frequencies that, even through research, have been shown to engage our body in a more of a parasympathetic tone. And like I said, there can be mats that you lay on where you get a general amount of electricity, of current through the body, very small vibration, and it starts to tune the nervous system to be a little bit more calm, a little bit more in that natural recovery process, but also guided PEMF. And we do this here in the clinic for a lot of people with muscle pain, with recovery from sports injuries, maybe chronic overuse or disc herniations, neuropathic pain, pain in the actual nerves itself. Those are all different modalities and reasons why we might prescribe a PEMF guided therapy where practitioners actually direct the current in the specific area of dysfunction. That's wonderful because we get to be targeted, consistent. We get to go to the root cause of where the dysfunction is coming from. But even more so, the more I do PMF, the more I see people discuss, yeah, I just feel lighter. I feel calmer. I feel, overall like I'm just recovering better. I'm sleeping better at night. And it's not just their physical pain starts going away, but some of the more mental and emotional pain that they are plagued with alleviate as well. So PEMF has been getting more research for depression, for anxiety, for some of these more nervous system based pathologies and diagnoses that we've been seeing. Research is really trying to push itself forward to show that PEMF has the ability to tap into those areas. And from my clinical experience, it's a wonderful adjunctive complementary approach to those who are dealing with those kind of nervous system dysregulation issues. So those are just some different tools. Like I mentioned here, biofeedback is that training, it's that nervous system getting to regulate with real-time feedback. Craniosacral PMF, more of those passive. You schedule them in, like acupuncture as well. These are all different approaches that whatever is really going to help your treatment plan and also fit what you want out of your overall adaptability and recovery, it's going to come into play in a way that synergizes, that really bolsters the whole approach. I like those approaches a lot, but again, I'll come back to biofeedback and plug that even more because you can take what you learn from biofeedback and apply it in your everyday life as if it's a medicine in your back pocket. But instead of it being a medicine, supplement, whatever you want to call it, it's a skill you've learned in your head. It's a skill that you've worked on long enough, hopefully, that it's not just in your head and in your thought process, but it's in your nervous system. And just like that visualization exercise where we talked about being on the beach, for those who are hyper responsive to that, I promise you with consistency and regularity, the practices you do in biofeedback are going to embed themselves into your nervous system so that when you engage in them, you're able to down regulate, downshift, and be a little bit more in control of how you respond to the stressors in everyday life. So practical takeaways, what improves HRV the most? Some of those foundations I was talking about. Let's get our blood sugar stable, having good fiber, good protein with our meals, good spacing in between our meals, staying hydrated, stress regulation practices, like mindfulness, breath work, recovery focused movement, not overexerting ourselves, not pushing ourselves in CrossFit gyms that are, always turning us on and on and on, with when our body's in the right place, for sure. Yeah, let's increase the intensity. But if we need a little bit more of a gentle, supportive zone 2 cardio, brisk walk, that's when we can use HRV to guide our recovery focused movements, daily nervous system downshifts, taking brief pauses. Sometimes a 15 to 20-minute meditation isn't even as effective as multiple 3 to 4 minute check-ins. It doesn't even have to be a formal meditation. It can just simply be sit down, try not to do too much, don't pick up your phone, let your eyes kind of soften, maybe shut them if you like, but just these little moments that tell our body that, oh, no, no, it's all right. We can tone down the amount of intensity we're bringing from our moment to moment interactions. And sleep, of course, going to be wonderful for helping our HRV. So simple daily reset, this can be a 5 minute reset. Slow your breath. You can even do it with me now here. Let's try. We're gonna inhale for 4 seconds and we're gonna exhale for six. Maybe put a hand on the belly, another hand on the chest. We'll take a breath in together for an inhale of 1, 2, 3, 4, and then we'll exhale 1, 2, 3, 4, 5, 6. And we might feel that the exhale is a little too long. We might feel that the inhale is a little too short. Just like exercise, just like anything that you do physically to bring your muscles up, you aim to practice this 5 to 6 breaths per minute, 4 to 5 minutes. That even in itself can be enough to shift your nervous system in a helpful way. Now, when we do it in the biofeedback approach with the more specific breathing mechanism, also maybe with some breathwork coaching, diaphragmatic breathing is not something everyone has readily available. The ability to breathe with the belly, when we take a breath in, our belly is expanding out. When we take a breath out, we're feeling that belly come back in. Those are all trainable and coachable, but simply finding a longer exhale to shorter inhale count, even if it was 3 seconds inhale, 5 seconds exhale, that ratio of longer exhales is always going to get our body in more of a parasympathetic state. So it could be a simple 5 minute breathing practice. Creating that intentional pause is huge. We're signifying to our body that we're safe, that we can rest. We don't need an hour. If you got an hour, wonderful. If you want to go after it and be the best biofeedback, best nervous system regulator in the world, that's awesome. But consistency is really what I want to preach here. Giving the body time to really realize what we're doing and what we're training. And now the nervous system starts adapting and attuning to that, as opposed to when the nervous system is attuning to the phone going off and the TV going off and the oven going chaos, chaos, chaos. We're trying to create an intentional pause. We can do both, but really we have to make an active effort to get those intentional pauses because society doesn't do as good of a job of promoting that, in this go, go, go society, right? So this is where we take our control back. And nervous system should be supported. These are all the different kind of approaches we were discussing. Integrative support, multiple modalities, some that are more passive, where you as a practitioner, you as a patient can just relax, let craniosacral therapy do its job, let the PMF do its job. Or the more active approaches like biofeedback, getting ahead on your lifestyle in terms of proper nutrition, proper exercise. All of those, when they integrate together, lead to longer lasting, stronger changes in our overall nervous system approach. Um, and like I mentioned, the goal is not to eliminate stress. The goal is to recover from stress more effectively. Recovery is a skill. Resilience can improve. The nervous system is trainable, and HRV offers measurable insight. Um, One of the ways to look into it is through these wearable biometrics. What I would like to implore is that don't ever look at an HRV that you have and compare it to someone else. The range is very large. Normally, it's stated at 20 to 200. Most ranges aren't having a 180 point difference, right? So what I want you to think about with HRV, whether you do it with a biofeedback type training, whether you do it with some of your wearable devices at home, it's relative to the particular person. So if we're someone who's normally hovering at 50 and whatever we're doing in our life starts having us jump to 80, awesome. That's a really good improvement. Um, and let's say we're someone that's generally at a 25. Don't be discouraged. Don't think of yourself as lesser than the person whose baseline is 50. It's all relative, right? Are we able to move that 25 to 50? Are we seeing that what we're doing in a way that's supposed to help our nervous system is actually shifting our HRV? If it is, great. We're actually really in a good spot. We're training our nervous system. It's showing that it's responding to our interventions. So everything is relative with HRV in terms of score. We want to see our score go up from our baseline, not necessarily have everyone be at 180. That's not realistic, and nor has it even been shown via research to be effective. The relative increase is really what is showing people have these positive outcomes that research is showing from HRV shifts. So recovery is possible. If this conversation resonated with you in any way and you're interested in exploring personalized support for nervous system health, recovery, resilience, I'd love to connect. Reach out to our front desk at the phone number below or via our website. You can book an appointment or complimentary discovery call if you have some questions and you still want to hash things out and see if this is going to be a good fit for you and a realistic approach for whatever issues you might be struggling with. At Regenerate Health Medical Center, we pride ourselves in taking a multi-systems approach, an integrative approach. Our visits tend to be an hour, hour and a half for new patients. So we're really trying to promote our ability to understand our patients and understand what of our many, many different treatment protocols can be most effective to getting you where you want to be. So I appreciate you guys listening to this webinar. Here are my references. Would love to open up for any questions if we have any. I'm not seeing any in the chat, but feel free to pop them in there or speak up if you are able to talk through. No questions or? All right. Well, we post these webinars monthly, so feel free to revisit any topics that I might have gone over too quickly or that you just want to get a better in-depth understanding. Send this to your friends and family who you think might benefit from some type of knowledge on the nervous system. Thank you, Sue. Busy calling the front desk. I love that. But yes, please share it with any friends and family. This is something that I'm very passionate about because I think the nervous system is something that it just isn't talked about in terms of our ability to influence it. And I don't want health to feel like it's all just reaching for this supplement or that supplement. There are plenty of supplements and medications and approaches that can help amplify what we're doing here. But having a good foundation, having something that is in our nervous system, in our minds, in our body that we can really train and utilize in our moments of stress. It's just a wonderful tool. It's made a big difference in my life to have some of these practices myself, and it's made a big difference in some of my patients' lives as well. So thank you so much. Great to chat. I'll see you guys next month for our next webinar.